In this video, we'll examine one of PharmacyX's key features, the ability to save clinical checks. When using legacy PMR systems, pharmacists are forced to perform a full clinical check on a prescription every time it is dispensed, even if there are no changes. By enabling you to save your clinical checks for up to 12 months, PharmacyX can reduce the need for 90% of checks on repeat prescriptions, saving a massive amount of time, but also allowing you to focus on new medication and changes, increasing safety. Let me talk you through how that works. Once the prescriptions have been entered into the system, they are grouped by the patient into an order and appear on the clinical checklist. When checking a patient for the first time, you, as the pharmacist, will do a full clinical check. You do this by clicking the check button next to the patient's name. The clinical check screen will then show you the patient's details at the top, followed by any information about possible interactions between drugs prescribed, any clinical notes previously recorded, and then all the medication on this order, as well as any other currently active medication that the patient has had previously. The pharmacist's task is to review each medication in turn. At this stage, you can edit the dosage instructions that will appear on the dispensing label for readability, and then, if everything is in order, click Review. Once you have reviewed all medications, the Save Clinical Check button will appear. You can select how long you want to save the check: 3 months, 6 months, 12 months, or do not save. You also have the option to save until the patient's next birthday, which nicely spreads your checks throughout the year. Once you have saved your check, the order will be ready to be dispensed. If you save your clinical check, the next time you receive a prescription for that patient, you can use PharmacyX's AutoCheck feature. Back on the clinical check screen, you can select the orders you'd like to AutoCheck individually, or you can use the Select All button. Then click the Bulk Auto Clinical Check button. PharmacyX will then review the orders and check the following things: that the previous review is still in date, there are no new medications, there are no changes in dosage instructions, there are no changes in quantity, there are no high-risk medications. This is configurable. You can set which medication you deem high risk, and that the prescription hasn't been manually entered, because there could be a transcription error. If all the checks pass, no further clinical check is required, and the order will move to the dispensing stage. If any checks fail, the patient order will return to the clinical checklist for the pharmacist to perform a manual clinical check. This feature reduces repeat checks by 90% compared to other PMR systems, freeing the pharmacist to focus on performing services and providing excellent customer care.